It is just a huge honor for me today to be podcast interviewing Dr. Cherilyn Sheets. My gosh, she maintains a full-time private practice in Newport Beach, California for aesthetic rehabilitative dentistry. She's an international educator, clinician, author, and researcher, and received numerous awards. Dr. Sheets is founder and co-executive director of a nonprofit teaching research center, the Newport Coast Oral Facial Institute. She and James C. Earthman, PhD, professor of Material Science and Engineering, are leading research on energy dissipation in teeth and implants. They hold numerous U.S. and international patents on technology for quantitative percussion diagnostics. She is also a fellow in the Academy of General Dentistry, American College of Dentists, International College of Dentists, Academy of Dentistry International, the Pierre Fauchard Academy of Dentistry. She received the 2002 Gordon Christian Award for excellence in lecturing. Thanks for not giving it to me, Gordon. The 2004 USC School of Dentistry Alumnus of the Year Award, and the 2006 Section of Honor Award, Distinguished Dentist Award from the California section of the Pierre Fauchard International Honor Dental Academy. I mean, my gosh, this Dr. Sheets has been a legend since I can ever remember. I mean, when I was getting my FAGD and MAGD, I was going to all your classes. And she's also big in the microscope. She got the Excellence in Clinical Research Award from the Academy of Microscope-Enhanced Dentistry, the honorary membership in the American College of Prosthodontist. To say you have a legendary practice is just an understatement of the year. So how are you doing today?
I'm doing great. My gosh, I wish my mom could have heard that. She would have been so happy.
Well, I was worried about you because when Jean was on, I guess she had the fire. She had to evacuate because of fire.
Yeah. Jean was in the evacuation area and she had to leave, but luckily we were not. So, but it was really smoky here, and air quality was bad, and a lot of our staff and their colleagues had to move out. But California's been having a pretty bad problem this summer. So we've been affected kind of the entire state. Well, the whole Pacific coast, actually.
Yeah, and it's a really big state for you international lecturers. I mean, my God, if you drive from the California-Mexico border to the California-Oregon border at 80 miles an hour on the interstate, it's a 12-hour drive. My gosh, it's like the 9th largest economy in the world. It's just all by itself. But I wanted to get you on the show so bad because when you go into dental schools, there's actually more women than men, and I cringe when I do 10 podcasts in a row and they're all, short, fat, white, bald guys. It's like, the dental school, the last thing half the class needs to hear is an old man like me when they got role models for you. Did you feel when you got out of dental school that dentistry was a man's profession and now 2020 it's not? Or how did you perceive it going in it?
Oh, absolutely. When I went into dentistry, my dad, who was a dentist, and I had two uncles who were dentists, he walked with me on the beach and he said, this is going to be different. You're really breaking new ground here. And I just said, oh, Dad, it's silly. But, it's always hard to think of yourself as a pioneer. And really, I think of the women that went ahead of me in dentistry as really being the pioneers. But the reality is that when I came out, when I graduated, I became part of 1% of the profession because the profession was statistically 99% male. So for most of my career, particularly during the maybe first 3 quarters, every time I did anything, it was the first time a woman had done anything. So to see all the women now that have come into the profession and the academic credentials they have going into dental school and what they're doing is really very exciting. I'm so glad to see it. So it's kind of equalized out. That's what I had hoped, was that at some point you would see an equal number of men and women being attracted to our profession because it's such a wonderful profession for both of us, for both sexes.
Well, I want to get right to the only male female. There's only like a couple issues I can think about. One of them, when you go into dental school, they're so sweet because the biology inside them saying that biology says you got to be the best parent in the world, and then the women know that all men are pigs, and that she'll even though she's a dentist married to a dentist, she'll probably end up having to do more homework and whatever. And she's just wondering If she really wanted to be the best mom, would it be better as an employee for, say, Pacific Dental, or you're out there in California with Western Dental, or owning your own business? Because a lot of them think, well, if I own my own business, I'm going to be there evenings and weekends and burning the midnight oil. And maybe if I just got a job at Western Dental, I leave at 5 o'clock and I can go be Miss Mom. What would you advise her on that?
Well, I think that it's an individual choice, that every woman has to make. I I was started off as an associate to my father, but by year 3, I knew I didn't want to be an associate. I wanted to be an owner. And I went to him and I said, Dad, I'd really like to buy into the practice. And he said, why in the world would you do that? You're going to probably earn more as an associate. And I said, because I want a piece of the rock. So I think you're kind of geared one way or the other, maybe. And both can work out fine for a woman with, a family life. We ended up having just one daughter, but by the time I had her, I was in 2 practices. I was practicing with my dad, and I was also practicing with Carl Reeder. I was lecturing. I was very overcommitted, and I found out I was pregnant. And so that was like, a shock. We hadn't expected that, but we were obviously quite thrilled to find out. So I just started getting rid of things that I knew I could get off my plate or that I didn't want to do, and I focused on the practices. But I didn't build my own practice until I was 40. And that's one thing I think that women have is, this incredible ability to have a long career, and you can reinvent yourself at different places. So for me, my associateship with Carl was a wonderful learning experience. My practicing with my dad as an associate and as a co-owner, had a tremendous amount of learning that went there. And, I just knew that I wanted to set my own agenda and have my own stamp, if you will, on a final practice. And that's what I've been able to have. So as far as the young woman that you're asking about that says, I want to be a good parent. I wanted to be a good parent. And I think that every working mom does. And you have to, have, I think, a really supportive spouse. In order to be able to pull this off. So particularly if you're a dentist and you're in your own practice and you've got appointments, and then all of a sudden your child isn't feeling well and you need to get to the doctor. Luckily, my husband, who's a financial advisor, had a little more flexibility with his appointments. And so he was able to, to step in. And then the other thing is, if you're working full time and you can afford it, particularly if you have 2 incomes, you need to have help. And I think oftentimes, women don't necessarily have that support system. But, I've always thought of the home as kind of a mini office, if you will. And I needed to have somebody there that could be there when I wasn't there. But as soon as I was free, then I wanted to take over, as mom and, do all those kinds of motherly things. So anyway, it's kind of unique for everybody. But all 3 of us in our office, I have the one daughter, Melissa, who now is married and has children. Jacine had three sons, 2 of which were twins who just turned 30, and Jean has 2 daughters. So we all kind of combined the, private practice with family life.
So Jacine had twins?
She had her son Andrew, and then she had twin boys right before she came into practice with me.
Because when they did that New York Times article that there's no research for floss, I would imagine that she would have known that if she had twins, they should have been separated at birth and raised totally differently, and then we'd have found out if the floss worked before they died. You're big into microscopes. Anybody? Well, no. I want to ask one family question before I go into that. You said your husband is a financial advisor, and your daughter Melissa and her husband are hedge funds managers. Is this the craziest stock market they've ever seen? And the $1 million question or $1 billion question in dentistry is, a dentist all want to know, are any of the DSOs over leveraged? And if there's much contraction, are they going to be all right? And I'm sure you get asked that question all the time with your whole husband and daughter and all that in hedge fund. But what do you think? Do you think this market is insane? And do you think there's any highly leveraged DSOs that are going to have to contract if there's a financial contraction?
Well, it is a crazy market. I wake up every morning and my husband has on the stock channel to see what the futures are doing. So I've kind of gotten a little bit of an education just vicariously, like he's gotten an education in dentistry vicariously by being married to me. Yes, it's crazy. October is always nuts, traditionally. So that was kind of expected. But then we've got so many other factors this year. It's definitely volatile. So that's the stock market. As far as the leverage aspect of the DSOs, honestly, I just don't know that answer. So I would be really
I
thrown
can
crazy.
I can tell. I mean, you don't have to be a poker player to know, but when you talk to the CEOs, I mean, you got all the way from Rick Workman. He looks like he's at a birthday party and he's all happy and all that kind of stuff because he's all liquid. And then you talk to some of these other DSO CEOs, and I mean, my God, they look like they just saw a murder scene or something. I mean, they are freaked out of their mind. I mean, you can just read the body language on the podcast. And in fact, after I podcasted one of them, I had about 3 or 4 DSO guys say, "Now, Howie, could you tell he was massively over leveraged and he was crapping his pants during the whole show?" I want to ask you.
You have your finger on the pulse of that question much more than I do.
Yeah, and I'll give you one advice on that is in dentistry, there's a lot of different silos, and the business of dentistry. If you're a dentist, and I don't care if you're a billionaire, Rick Workman, or a landless squatter peasant like me, that whole spectrum, all the big corporations are on LinkedIn. So a lot of times, when you spend your whole social media deal on Instagram and Snapchat, you're probably talking to other kids in dental kindergarten school. But if you want to know what the big movers and fryers that are doing, and what's neat is a lot of times I'll make a post, and then some Wall Street banker guy will private message me, and oh my gosh, and they always ask the same question, and I always want to see if they're going to ask it differently, because you and I are old enough to remember the first one was Orthodontic Centers of America. We lived through that. Lazarus realized that just like in real estate, you can sell a 3-bedroom, 2-bath house, but you can't sell a 9-bedroom house. That's why the NFL is always going bankrupt. They don't have liquid. And dental offices, if your office is for $750 in a metro, you can sell it today. But if it's $3 million, DSO is about the only person who write you a check. And Lazarus saw all these big $2, $3, $4, $5 million ortho practices, got a big line of credit, took them all public. The only guy who made the New York Stock Exchange with Orthodontic Centers of America, the whole thing internally collapsed. Wall Street will not touch these guys again. And they all the financial guys say, well, it seems like they'll buy it, they'll dump some money into it, but it's like a hot potato. They just want to see if they can fix it up and sell it to another private equity guy. And then he tries to sell it to another private equity. No one will hold this. I mean, look at Clear Choice. I mean, what have they had? 5 owners by now? I mean, and the real exit strategy is I'm going to go to NASDAQ and I'm going to do an IPO. But Wall Street won't have it because they were burned so bad with the first one. But specifically on prosthodontics, if there was a kid in high school right now saying, I could see following your husband and your daughter and being a Wall Street person, or I could see being a prosthodontist. Now that you, with all this illustrious career, how would you answer that question?
Oh, I love what I do. I love what I do, and I do it all over again. And it's interesting. But my husband loves what he does, and he's absolutely not oriented at all towards medical. So a lot of it depends upon the person. But one of the things that I've always treasured, about dentistry is the fact that you can kind of create your own canvas. You can change it constantly. So when I started off, I was in a family dentistry practice, and then I just kept gearing more towards the more complex cases. My dad started referring me all of that. And then you start getting more and more education, and then you start taking on more and more complexity. And as I look back, I've been able to have interests, that you could follow. And then all of a sudden that leads you down a whole nother road or a whole nother direction. And it's a little, not to sound too country, but like making a quilt, you keep putting different pieces of education information together. And dentistry allows you to do that as a small business person, where you can basically, to whatever extent anybody can, just set sail in the direction you want to go. So going back to your first question about the young woman, that's trying to decide which way to go. I mean, maybe she starts off in a in a DSO or in an associate position, but then ultimately wants to be her own boss, and she can do that. And then, wants to bring in partners, and, there's just so many ways, or maybe they want to go into education. And I just have loved, the way that I've been able to do it. And I'm so blessed to have this incredible team around me of people, both dentists and support people, within our laboratory, our hygiene programs, and, our other aspects of the office. And I've gotten to get involved in areas that I never thought I was going to be involved in. So,
I call it dentistry and censor because I don't want to talk about anything everyone agrees on, even though it's hard to get two dentists to agree that today is Friday. But I want to go to Microscope. You're a legend in microscope dentistry. You're a legend in prosthodontist. You're really, you were a legend. When I got out of school in '87, you were like born a legend. But the microscope. So I'm gonna play. Everybody knows the fastest way to increase your quality is just magnification. Loops. You start off at 2.5, then you go to 3.5, whatever, and then you look at microscopes. The endodontists all have them. All that kind of stuff. If you can see it, it's going to be a lot higher quality. Just imagine the opposite. Imagine if your dentist wasn't Cherilyn Sheets, but it was Stevie Wonder. That would be a very, very difficult, challenging restoration. But microscopes also, when people ask me how much does a microscope cost, I say, well, who cares what it costs? I don't care if they give you one. When I got out of school in '87, I came to this town, Matloff, Liebau, all the legendary endodontists were doing 8 to 9 molars a day. And then the years went by and they decided I want to see better. Yeah. Well, that seeing better slowed them down to 4 to 5. So when you look at their income, I would have to say the microscope is my gosh, it's probably worse than Sargenti to these endodontists because look at their income. Dental specialists, in general, dental specialists make $320 and general dentists make $197. General dentists who own their own practice make $244. Dentists who are employees make $147. So you make $100,000 a year more on average to specialize instead of not, and you make $100,000 a year more if you own. And that's what the word socialism actually means. If you ever read more than the first page of a political science book, socialism means I own. It's a worker's right to own their means of production. They wanted to own their land, and they'll pay the king in taxes, but they didn't want to be an indentured servant or a landless squatter peasant. And that's why in these downfalls, I cringe historically when dentists are selling their means of production to go be an employee. In history, you always want to own your own place. But oral surgeons are the top dogs, $448. Periodontists number 2, $330. Endodontists are number 3 at $307. And before the microscope, they were neck to neck with oral surgeons, and now they let them damn gum gardeners pass them. So, do you think the microscope is one of those things where it clearly increases the quality, but you're going to have to increase your costs because it's going to increase your time, or what is your thoughts on that?
What's my opinion on that? Okay, so there's really a good question. I can give you a long answer, and I can give you a real short answer. So
long.
My opinion is just based upon not only my experience, but probably 2,000 more dentists that we've taught through the years. And there's a couple of ways to look at this. One is the quality of the work. The other is the quality for the dentist. So let's look at the quality of work first. I had two companies, Global and GenMed, that came to me and said, we know that the microscope has totally revolutionized endodontics, but we don't know if anybody can do this for restorative dentistry. So we would like to have you evaluate it and see if you think this could be helpful. So I'm always willing to look at something. I'm always curious. And so I said, sure, we'll do it. So they brought 2 microscopes into the office, one for me and one for Jacine. And we started to look in it. And I had just finished some porcelain veneer preps. And so I pulled the microscope over to look at them. I thought they were pretty nice preparations. And when I looked at it, I thought, oh, gosh, what's this little blip here? So I went in and I slowly, started to smooth it out. And so then you'd find something else and you kind of dinked around. And then you move the microscope away. And I looked at it and I said, this is the best work I've ever done. So I was hooked. I mean, that said, okay, we need to know how to do this. And then Dennis Shanelak and Cliff Ruddle said, no, we can't teach you. You know, we just know for our fields, but you're going to have to figure out how you are going to learn. And then you're going to have to figure out a faster way to teach people. So that's what we did. We made the commitment because we started seeing things and seeing ourselves capable of doing things that we couldn't do without that magnification and illumination that the microscope brings. So I think what happens is with the increased quality of work, your reputation starts to be spread because your patients are telling people about the fact that their dentist used a microscope, and you get a better quality result, and it builds the reputation of the practice. So that's one aspect. The other aspect, which I didn't expect at all, was me, how it affected me. And I had, like most dentists, neck issues and, headache problems. I just thought was normal. I just thought that that's what everybody had. And what I realized was it was because of the posture, the insane postures that we have to have as dentists when we're doing long appointments. And a lot of our days, because we're doing a tremendous amount of full mouth reconstruction, I'll sit down and start prepping at 8, and I won't even get out of the chair until about 1 o'clock or 2 o'clock to take my first break. So if I wasn't sitting up ergonomically straight, looking through the microscope, which is like looking through binoculars, where I have no pressure on my neck or head and no oculars pulling down, even though I do use oculars with a light on it for, at times, but taking a lot of that off of my body has kept me much younger and healthier. So, I do work out, I do take massage, I try and treat my body like I'm an athlete because I'm not near done practicing and I want to continue on. So if you think in terms of speed and income level, my income level is actually increased since I've been using the microscope. And I think for 2 reasons. One, because of this quality thing and the fact that I'm healthy. And I know a lot of my colleagues have already had to stop practicing dentistry because of disability problems. So longevity counts for overall income for your, for your lifetime. But even as I look at myself, right now on a day-to-day basis, it's definitely been a positive for me.
What I decided to do with the exercise and eating healthy and all that stuff, I decided to just be the control group. I mean, someone needs to be the control group.
Well, and you're still going strong, so I'm glad we've got you in a control group.
Those microscopes, I mean, it really is amazing. One of my dentist friends is really into outdoorsy stuff and everything, and he did this great thing for me, and I didn't know what to get him, but I bought him a pair of Zeiss binoculars. Because you just get a pair of binoculars and you're not really sure, it's a little bigger. You get Zeiss binoculars and you're outside like a half hour before sunrise and a half hour after sunset. You think you have night vision goggles. So when I think of microscopes, there's Global Microscopes out of St. Louis. You mentioned another one. What did you say? You said GenMed?
GenMed, but I don't believe they're making microscopes for dentistry any longer.
Okay.
But there are a number of companies, that, and Zeiss is another one that you mentioned. And then there's a number of Asian microscope builders. And, Leica was in for a while making microscopes, and they came out of the making it for dentistry, and then they've come back in. So there's many choices. The nice thing about the microscope, Howard, is that when you invest in a microscope, it lasts forever. It's not like investing in a computer and then 18 months later, they say, oh yeah, that's out of date and you have to go in and replace it. So you're buying a piece of equipment that's gonna be able to be utilized probably throughout your entire practice career. And the other thing is, I've got video camera hooked up with a digital, and you can document things and you can show the patient what you're seeing. And it's magical. I mean, they look at that and all of a sudden they don't have to just, quote, trust you, what you're telling them. They can see it at the same time, and they're extremely appreciative. And you can document, the destruction that you're seeing under a restoration that maybe doesn't seal well or something like that. And they can understand why you felt you needed to take that off. So there's so many side benefits besides just the visibility and magnification when you're working.
Yeah, I had an associate that I mean, he was young. I'm 58. I think he wasn't even. I mean, he wasn't even 40, and he had to get a microscope because if you think about it, like a submarine guy, he could only look straight ahead,
Yeah.
and so he's doing a microscope, and then he also did something where he went to Costco and got a big screen, so he could even see it on the TV, and that was. Amazing. But I've seen all kinds. I've seen a friend of mine in Wichita. He actually was in the wrong place, the wrong time, and his place got robbed, and he got shot and was paralyzed. He was fine, but and he was fine. And but I've had so many people that I know they couldn't practice anymore
Right.
because they physically couldn't do it. So do you? They're always gonna ask. You're a prosthodontist. What are you using it? What magnification is it? 4, 6, 8, 10?
Yeah.
How big are you magnifying it?
Well, first of all, I'm a prosthodontist because I'm grandmothered into it. I didn't go to a specialty program because I just want to make that clear. And by the time I was out of school for 9 years, that's when the programs actually started. But I have definitely done prosthodontics my entire life, and that's where my lecturing and research and everything has been. So now going back into that, because you said it a couple of times, I just wanted to clarify it for any people that are really concerned about that. What was the question now? Tell me again.
My gosh. Well, I want to talk about that first because I think that specialty thing just got thrown away. You go to the greatest endodontist. My God, John McSpadden and the McSpadden condenser. Well, he never went to endo school. They didn't even have him back then. It was just practice limit endo. And then we saw a couple of years ago in Texas where someone was advertising that they're an implant specialist, and of course, the boards weren't going to have that because the ADA doesn't list them. And I went to court, and the Texas judge said, dude, the ADA is a membership program. What does that have to? It's not a state regulator. And furthermore, he does have a practice limited implants. But what I have seen on this business model is, you're right. When we were little and you just wanted to be an endodontist, you just practice limited endo. And then the dental school said, well, how can we steal more of this young child's future earnings? Let's make it a 1-year program. And then within like an hour, it was a 2-year program. And now they're like, well, let's make it a 3-year program. And what they need to do is just go for it. They need to make specialty school an indentured servant program where if you get accepted, you're chained to the chair and you just work for dental school deans the rest of your life. But the bottom line is, I have seen this with my own eyes. One was a small town in Albuquerque where this guy was on dental town. Not Albuquerque, small town in New Mexico. And he says he was thinking about going to endo school because he's in the town of 8 dentists. They all hate molar endo. He hated everything but endo. And everybody was like, well, why the hell would you go to endo school? You've already been doing this for 20 years. You've gone to all the courses. Cliff Ruddle, he took every Ruddle course known to man, which are all written by Phyllis. Cliff's just the pretty boy that gives a lecture with that wig he wears. And so the bottom line is just practice limited. Like kids are telling me, they're saying, well, I want to be a pediatric dentist. I say, well, first of all, nobody wants to work on crying, screaming children. I mean, I'm wondering what went wrong in your childhood. I would tell a doctor first that you're having these thoughts of becoming a pediatric dentist. But my gosh, if I was in the middle of a pandemic and I wanted to be an endodontist and I looked at the cost of that for 3 years, I mean, just half of 1 year, you could go to every postgraduate program in endodontics from here to Europe to Istanbul. So you don't have to go to specialty school. That is an American Dental Association thing. It's kind of like if you become an Eagle Scout. I'm so old, when I was little, they didn't even have Eagle Scouts. It was a pterodactyl scout. And my gosh, I don't know. Do you think if someone wanted to be a prosthodontist, you're the co-executive director of the Newport Coast Oral Facial Institute. If someone just came out of school, $400,000 in debt in the middle of a pandemic, and said, well, should I just go to prosto school for 1, 2, 3 years, or just take half that money and take every postgraduate course there is on prosto? What would you advise?
In this day and age, honestly, as economically unattractive as it is, I'd say go to a specialty program, because in a concentrated time, they're going to give you an in-depth education that takes years and years and years to accumulate. And so often the weekend courses, even though when any of us give them, we try to give as much meat as possible, but it's oftentimes a lecture, it's not hands-on. And, you really need to be mentored by somebody. I had the incredible opportunity to be mentored, shoulder to shoulder for 9 years, which really taught me how to read the literature, how to give lectures, how to, understand what to look for, how to be more definitive, in my analysis. And most importantly, I think one of the best things he did that totally changed my life was taught me how to do a comprehensive examination. And the depth of that comprehensive examination changed everything for me, because I started, with the kind of just typical dental practice that, my dad was doing and practicing in a very traditional way. And when Carl had me start doing 2-hour, examinations on patients, my dad thought, oh my gosh, between all the CE you're doing and all of these long examinations, we're going to go bankrupt. But in fact, what it did was it gave me a much better concept of what those patients' needs were. And instead of just seeing a fractured tooth and saying, oh, we need to put an onlay on that, or we need to put a crown on it, I started realizing that by the time I looked at the occlusion, and what was happening as the patient moved into balancing interferences, that this tooth on the opposite side in the same area was setting itself up for an additional fracture. And you start putting pieces together with the perio, the occlusal TMJ, the dental examination, the oral cancer examination, and you've got all of this data at one time. And by the time you go to make your dental diagnosis, it's just so easy. You know what needs to be done in phase 1 to take care of problems for the patient, the dental IQ of the patient, how receptive they're going to be to care, whether you need to put them through a preventive program in order to change habit patterns. So when you go in to do the dentistry, they don't destroy it right away. And it changes the way you approach things. And when I started working with Carl, I saw that instead of going in and when every time you diagnosed a patient, you had to do more and more work on them just throughout their lifetimes, these patients, would have a reconstruction. They'd invested in their mouths. They'd gone through preventative education. They knew how to take care of themselves. And from that point on, they were just getting their teeth cleaned, and every 3 years getting an examination. So it's a whole different philosophy of how to really approach dentistry and dental care, but it's more of a systems analysis way of diagnosing and treatment planning and treating.
When you're saying Carl, are you talking Dr. Carl Reiter?
Yes, Carl Reiter.
Oh, it's Reiter.
It's Reiter.
Okay, yeah. And he was one of your strong mentors in the beginning?
Yeah, I actually met Carl when I was 21 years old. I was in dental school, or 20, maybe. Yeah, 20. And it wasn't until after I was out practicing with Dad and I was on the California Dental Association Scientific Sessions Committee that, we were brought back together. And when I was thinking about maybe seeing some of our patients from Inglewood down in Orange County, he had said, well, I think you should see them in my office. And, long story, 6 months of discussing back and forth. Finally, I thought, why am I fighting this? This is such an incredible opportunity to get a prosthodontic education. And so that's how it all started.
So, so he didn't go to prosto school either, did he?
No, none of those guys did. They were all grandfathered, into pros when it became a specialty.
I mean, guys, he was born in 1945, so it's kind of a new thing, and it's interesting how people you look at the history of why something was started, and it looks very different to you. You know what I mean?
Yeah.
Than it does now. Was there anything else you wanted to say on microscopes? I mean, a lot of people just want to say, if like Indidons say, well, I only want to look at 4, 6, 8X. And then they see these cheap ones on eBay, but you bought this one on Global. There's a high-end Zeiss. Global's out of St. Louis. It's more a value price. Zeiss is out of Germany, so you got the transporting it. But the dentists always want brand names. So how would you answer that? Would you go with the brand?
I think it's two things. One, you should look through them and see the optical qualities on both, and then also look at the service. What are the companies going to do to support you once you have the microscope? Because you do need to be trained on it. I mean, Justine and I, Dr. Paquette and I learned on-the-job training, and that's the most stressful, the hardest, and the longest way to do it. So to be able to have some people, and now there's multiple sites where you can get training in it, a really good program that's on the weekend cuts about 6 months off your learning curve. So I think that that's important. I feel that the learning curve for using the microscope is one of the best times that I ever devoted to my personal education. It's that impactful upon my career and me personally. So that's it. I think that really what needs to happen, Howard, is they need to teach this in the dental schools, because we all kind of gravitate towards what we learned in dental school, unless you really are constantly looking for new and different things. But technically, I think that that's a really valuable time to get habit patterns that you're going to carry with you throughout your lifetime. So certainly striving for excellence, is something that we all were taught in dental school, and that's something you want to carry with you your whole life. But to be able to learn how to use this very simple technology that has such a powerful impact upon your entire life in dentistry is worthwhile to be taught in schools.
I want to go to Prosto, and I have a bias for the kids. I mean, these are podcasts. I mean, all my friends in Phoenix that are my age, if I put a gun to their head and told them to find my podcast on their iPhone, I'd have to shoot all of them. When they sounds like about a quarter of them are still in dental kindergarten school, and the rest are under 30, and you're too overqualified to speak to them, but they're coming out of school. And for the first couple of years, they need to learn the basics. I mean, when you start playing football, let's learn how to pass, catch. Let's learn the basics of a block, a tackle, a pass, a catch. And they're in fixed prosthodontics. And when I sit down with my insurance guys, there's 32 teeth. And you look at all the claims made, and there's just 4 big spikes on the 6-year molar. I mean, 80% of the dentistry, what tooth's most likely to have an MOD, a crown, extracted, replaced an implant, a bridge, whatever. So she's sitting down. We're just going to do baby steps. We're going to do 1-tooth dentistry on a 6-year molar. And the question she's asking is she going to think I'm a bad dentist if I use a quadrant bite? When should she use a full mouth impression? When should she use a quadrant tray? And I'm sitting here wondering, do you even use vinyl polysiloxane and polyethylene anymore? Are you all digital scanning now, or are you still using goop?
But we still use goop. We take a lot of polyvinyl siloxane impressions. We have 2 different digital scanners. We have the 3Shape and we have the iTero. We invest a lot in technology in our office. But the truth of the matter is, as much as we are embracing technology on all levels, which includes digital impressions and digital scanning and all of that, when you get to large arches, there still is some problems, with the discrepancy. So we're taking our polyvinyl siloxane impressions too, and we've got a way to kind of cross-check things. But as the technology improves and expands, everything just keeps getting better and better. So I'm sure that some of the problems that are still there will get solved. The interesting thing, you asked about a quadrant, tray or full arch. What we do is we take quadrant trays for dies, but we always take full arch trays for master casts, even if we're just doing a single crown.
Can you repeat that? Say that one more time.
Yeah, I said, even if we're doing a single crown, we always do a full arch impression for the master cast. And then we'll use quadrant impression trays to get the dies. And the reason we do that is because it gives the technician then the entire arch for all of the occlusal movements, and you end up with less adjustments when that restoration goes back to the mouth, which saves the dentist chair's time.
That is interesting. I want to go back to the digital oral scanner, because I can tell, I can tell what they're doing on dental time. I mean, there's many different behaviors on dental time. There's a real popular one is they just go to today's active topic. What is everybody talking about today? And it can be all over the board. But a lot of times, you can tell by the dollar amount. Like when they're going to go spend a lot of money, they'll do a search and they'll stay on there for like an hour and a half or 2 hours, 3 hours. And they come out of dental school, $400,000 in student loans, because obviously, I got out of high school in 80 to 2020, 40 years, just a solid 1.5 to 3% GDP growth for the 20 richest countries, including America. Whereas education, they've been disconnected from reality. There's no gravity. Their costs are going up. They've had no eye on cost. What dental schools have done is just it's just sick. I mean, to strap this little kid with $400,000 in debt, and he thinks it's a bad deal because he hasn't got divorced yet. So when you're 25, you think 400,000 is a lot of money, but after he gets a divorce, he'll say, "Man, that was chump change." But when they're when they're sitting there coming out of school, they're like, "Oh my gosh, well, everybody says I need a CAD/CAM CEREC machine. That's 140. Everybody says for peri-implantitis, I need that LANAP Millennium laser. That's another 140,000. You're saying to get a microscope, and all this stuff is big money. And when we talked about oral scanner, you said 3Shape and iTero, and I want you to go into that because you're different. You're a prosthodontist. iTero is owned by Align, which owns Invisalign. So all the orthodontists or any general dentists that are a cosmetic dentist can do a bunch of Invisalign. They always get the iTero. But I notice if you have no ambitions of ever doing clear aligners and you're just looking at the scanner, they go with 3Shape out of Copenhagen. So why did you have both? Are you doing ortho clear aligners with iTero and Crown and Bridge with 3Shape, or why do you have both?
Yeah, that's exactly right. That's exactly why we have both. We had purchased 3Shape because at the time that we did it was better for the cost that we were doing, but it also allowed us to do clear aligners because Invisalign also took the scans from 3Shape. But then when Invisalign bought iTero, they made it mandatory that you use iTero. So I mean, you could fight it, but the fact of the matter is we wanted to keep working with Invisalign, so we just bit the bullet and bought it. But really, what you started with, I think, is really important. And I want to go back to one of the statements you made. And that is, here's this new young graduate out of school, and, people are telling them they need to have, digital x-rays. Well, that makes sense. Okay. But then they need to have, LANAP. That doesn't make sense to me. And then they need to have, a scanner. Well, maybe that doesn't make sense. You've got all of these fabulous, things in the candy store, if you will, to buy. But you don't need, and you in fact don't want to buy all of them at once, because it goes back to what you also said about you need to learn how to block, you need to know how to throw, you need to know how to do all the basics in the football game before you start, doing these razzle-dazzle different things. So one thing that we discovered, even ourselves being very mature, dentists, when we did one of our expansions in the practice and we turned into all these digital things, as far as new technologies, we realized we had overbought for our ability to learn and master each of the different technologies. So one of the things that I would recommend is that if you're a new dentist and you're setting up your practice, is to not feel like you have to have everything at once. You want to be able to make sound economic decisions. You want to be moving in the technologies that are going to be the best for you and also help increase and stabilize your revenue stream. And then you can add on, different technologies. And also be sure that that technology has been out there probably for at least 5 years, if you're a young, person who's investing in these, so that that it's not just a flash in the pan that fizzles out. So anyway, that's something that when you made those comments, it triggered those thoughts in my mind. So I circled back.
Well, those are great thoughts. But I'm going to pin you down on this. I'm going to hold your feet to the fire because they're big purchases. Like, I just see the baloney. Like the people selling the CEREC machine, Dentsply Sirona. They have all these people out there saying, "Well, I do all my anterior veneers with that." Well, I've never met a cosmetic dentist in Beverly Hills that uses a chairside milling machine for that. I mean, some of it's crazy. But yesterday, the European Federation of Periodontology came out with their EFP guidelines, and EFP publishes first evidence-based treatment guidelines for periodontics, and they indeed it set off a controversy on Dental Town because it says suggest not to use lasers as adjuncts to subgingival instrumentation for peri-implantitis. You're a prosthodontist. You get referrals from all kinds of periodontists, oral surgeons. You get to see this industry very unique. Do you think, what did you think of those guidelines, the European Federation of Periodontists saying that lasers aren't part of the picture in treating LANAP or treating perio failures?
Well, actually, that's the first time I've heard about it. So, I'm hearing it for the first time. We have a peri-implantitis protocol in the office, which is really pretty inexpensive that any young dentist could utilize without having to invest. And that just concentrates on using antibacterials and home care. And so we'll go in, and if we have someone who is really showing signs of either periodontitis or implantitis, we place them on Jorgen Slott's, one of his techniques, which is using the water pick with a small amount of Clorox in it. A few drops of that helps kill off the bacteria. And then when they come in for their hygiene, we actually infiltrate, around the implant so that it's given a deeper soaking, if you will, of that. And it has been between the biofilm control, maybe measuring, we use like an oral DNA, and we can measure the bacteria that are perhaps causing the greatest problems. We can do targeted antibiotic therapy and try and change the patient's habit patterns and lifestyle. And that's been extremely effective for us. So anyway, it's certainly we can add on other things, such as lasers, but if you aren't doing the basics of bacterial control and using antibacterials and frequent hygiene visits, I don't know that the laser is going to be a solution anyway.
All righty. Well, I just emailed you the link to that article.
Oh, thanks.
Yeah, and there it is. I'll send you that.
Okay. I won't read it right now.
What's that?
I said I won't read it right now. Is that okay?
Well, I want to go back to that protocol because it's very confusing when you're a kid and you're in dental kindergarten. You're you're learning, don't place implants if they're a smoker, they have high blood pressure, they have all these things. Then they get out in the real world. Newsflash, your vegan yoga instructor isn't going to need all on four, So the only people that show up are just human disasters. I mean, they smoke, they drink, and I'm not just talking about the Irish. Even other groups will do that. So she's comes out of dental school brainwashed. Oh, well, you smoke, you have high blood pressure, you don't take your medication, you do everything wrong. And then they're like, well, I just got rid of all my patients. Because everybody that needs an all-on-4 doesn't own a water pick. So how do you teach a kid? And then I want to circle around all the way back to the beginning. Is this? Here's the 20-year journey for a dentist. The reason we started Online CE in 2004, and the reason I started this podcast 4 years ago, is because it's obvious that if I had to pick one variable that correlates with success, and I don't mean success money, it means they love dentistry, they like going to work, they buy toys, they buy things. The number one thing I see it correlated to is the number of hours of CE. Because if you take 100 hours of CE a year, you're getting exposed to Cherilyn Sheets. You're getting exposed to all these ideas, and you're unique. But after 100 hours of stuff, you're going to find something that gets you motivated. And my gosh, they got an hour commute, and they get to listen. I'm bringing them Cherilyn Sheets for free while they're driving down the deal. So you got to do your CE. But the other thing is, you got to do your CE. Where was I going with the other thing? Where did I? You do enough CE. You start with 1-2 dentistry. And then it takes you about 5 years to figure out, well, golly, if I'm going to numb the whole quadrant, I might as well do the other tooth in that quadrant. Okay, now we know you're 5 years out of school. And then about another decade, you'll say, well, hell, if I'm going to be on the right side, I might as well do the whole right side. But then they stop there because they can't do both sides at once because, you've never seen an oral surgeon numb up all 4 wisdom teeth and pull them 8 times a day from age 25 to 65. Nobody wants to come back. So they do this journey from 1-2 dentistry to quadrant dentistry to right side. They never make it to full mouth like the oral surgeons, but the skill set you need the most is diagnosing and treatment planning. and prosthodontists are the best. And the second best would be a periodontist. And in fact, when I did my referrals, I would never refer to a specialist since they only did one thing. I had one thing I valued them on, and that is, you send this kid to an oral surgeon because he needs 4 wisdom teeth. He didn't look at anything else, pulls the 4 wisdom teeth, max out the insurance, and trash it for you. I would only refer to a specialist if we can email them the x-rays and the treatment plan so that I could have another authority father figure go in there and say, like an endodontist saying, we're going to do this root canal today, and it's $1,000, but you have 4 fillings over here that are like $250 each. And if you don't go back there and fill those, every one of them is going to be $1,000 root canal. In fact, I'd rather pull this tooth and take that $1,000 and do 4 $250 fillings. So I don't want to take all your money and sink it in one tooth. So, I mean, in the United States, at age 65, 10% have no teeth. At 75, 20% have no teeth. So let's not spend your whole dental budget on one tooth. But just having that another doctor go over and give his presentation just was miracles for the treatment plan presentation. I mean, it just, they'd come back and they say, yeah, I was just going to get that fixed, but he was right, man. He said what you said. He said, you got to go back and get those fillings done. So if I was a young kid, I would be looking for someone that can teach you diagnosis and treatment planning, and that's only going to be a prosthodontist or a periodontist. And it's a hardest skill set, and if you can learn that in 5 years instead of 25 years, I mean, life's going to be a lot easier. Would you agree with that?
Yeah, well, I would agree with a number of things you said, and it kind of sparked some thoughts in my mind. Let's go back, and I want to try and touch on a number of the things you said. But when you talked about the patient that comes in that is an absolute disaster, they're smoking, they've got diabetes, it's out of control, they've got plaque everywhere in their mouths, and it's a disaster. It's a dental disaster. That's the kind of patients that we see a lot of. And so the way we approach it is we don't go in and start diagnosing that we're going to do a quadrant, or a two. We take it in mostly like a triage. The first thing we're going to do is, as we are determining, where we've got to go in to intervene, if they do need a root canal, or we're going to have to clean out the decay because we don't want to go into a root canal. We're going to put a provisional crown on it, and we're going to stabilize it. And while we're doing that, and the patient wants to move forward ultimately into permanent treatment, we are going to have them with an oral health educator in our office, who is going to be showing them the bacteria in their mouths, disclosing it, teaching them how to brush, getting them on a water flosser or fusion or something like that. And the amazing thing is, Howard, is these patients who have been absolute dental disasters start to feel better. I mean, they start to feel physically better. They start to see that they're taking more control of their mouth, and they're starting to get the picture that this is the way to really control their costs. Because if you can get someone who goes in and really cleans up their mouth, cleans up their lifestyle, cleans up their diet, they're going to start feeling better, and you are building longevity for that patient, for your practice, and also for long-term dentistry. Oftentimes, I practiced in Inglewood, California, which I don't know if you're familiar with Inglewood at all, but it's right by LA International Airport. It's right by the Forum. It's a community that I watched drop down the economic ladder, lower and lower financially. And I took that same philosophy, that I was doing with a very affluent community into my care for my patients, in the Inglewood community. And they appreciated the fact that we weren't just there to put a crown in or put a filling in, but that we were really trying to help them get healthier and get a better lifestyle and a healthier body. And, they were extremely loyal and beneficial. And some of those cases took much longer. I mean, there would be patients that, the treatment spanned over 7 years. But ultimately, we just kept building the pieces that we needed until we got them there. And we did some very sophisticated dentistry on these patients that needed it, but could afford it over a long time period. So anyway, I don't know if that answers, some of your question, but I just can't overemphasize how important I think it is to have a systematic plan to help your patient be better, so that when you do your dentistry and you're trying to do it to the highest level that you can, that it's going to last for that patient, and they're going to be able to really take care of it and feel good about making the investment, whatever level it is.
So I got to tell you something funny when you're talking about, do I know Inglewood? This is how straight out of Kansas I am. So I was born in Wichita, Kansas, went to Creighton undergrad in Omaha, and then went to dental school in Kansas City. And a lot of people say, why didn't you go to Creighton Dental School? Because my parents were Catholic. They had 7 kids in like 3 days. And my brother Paul was born after I left home, and Omaha was an 8-hour drive, and Phoenix and Kansas City was 4. But then when I got a senior year in dental school, I wrote the Department of Economic Security, and I said, this is before computers, laptops, any of this stuff. And I said, what are your economic growth projections? And they sent me this big report that all came true, that it was in 85 to 2000, they thought the United States created 30 million new jobs, and half of them be in 5 towns. And it was Orange County, Silicon Valley, Phoenix, Boston, and Tampa. And I was so straight out of Kansas. I mean, I wasn't going to go to Florida because the insects there is insane. Everybody has nets around their deal. And Boston's frozen. I'd already lived in that. And but I was afraid of California. I mean, I just thought, well, I'm not going to raise a family in California. They're all hippies on drugs out there. And I was literally scared of California. And that's been one of the most interesting things, because now that 32 years out of school, oh my God, some of the most conservative dentists I ever met in my life are from California. And here I went into that thinking they were all just wild hippies. Same experience I had with India. When I grew up, in Catholic school, Mother Teresa Calcutta was like, she was like higher up than the Pope and Jesus and all that stuff. And they told us how they're all vegans and they only eat plant, and they're so healthy and they're just the healthiest vegan dieters in the world. Then I go lecture over there the first time. Every dentist house I walk into offers me a platter of sugar cookies, and it turns out that I think Indians eat more sugar than anybody on Earth. Crazy misconceptions I got. But all I want to say on this is that when you buy a big purchase, it makes you feel good. I mean, you feel like it's like a congressman, or a senator when they get elected to go in office. I mean, they're only going to be known for what's the big $1 billion deal that you signed? I mean, humans just don't feel like they did anything unless they spend a bunch of money. So I really want to grow my practice. So if I just go buy a $135,000 CEREC machine, well, doesn't that just by itself make me a better dentist? No. I don't even get the CEREC machine. And that's what I'm going to hold you to on this. When I talk to prosthodontists, they seem to be the least likely to have a CEREC machine. And I mean, and so you're doing the best crown and bridge margins of the general dentist. Why do you not have this CEREC machine, or do you have it, or do you teach that?
No, we don't. And I understand it's extremely helpful, for a lot of people. And they have made tremendous improvements from the original models, which didn't have good marginal adaptation, all kinds of other problems. And I think, once again, like we talked about technology, the longer it's there, the more refined and the better it gets. But the reason that we don't have it is we don't do a lot of one-tooth dentistry. So we're oftentimes looking more towards what that patient, is going to need. And we have our own in-house laboratory with 8 technicians that just work for us. So we've searched over the world, to try and find people that were really highly technically trained that could do the more sophisticated work that so many of our patients need. So one of the limitations of the CEREC is that you basically have a monochromatic restoration, and that oftentimes the occlusal anatomy, is either chosen from a replication of what the tooth was to begin with, which oftentimes is worn, or now you have chances, to pick something out of a directory, where you can get something that's more current and looks like a not worn tooth. So they keep modifying things, getting them better, but it's not applicable to what we do.
And the other thing is, I mean, I mean, none of it makes sense. I mean, so, here it is. Okay, so I prep the tooth, I take an Imbergum, I send it about 8 blocks down from my office, and there's a guy there as old as me. In fact, we're on the same diabetes medication and erectile dysfunction medication. I mean, we're taking all the same pills. And he's made like 30,000 crowns. And then your idea is like, Well, hell with that. I got an idea. Let's spend $135,000 of other people's money, and then I'll train my assistant who's never made a crown to start making my crown. I'm like, dude, you just went from no capital intensive. And this is why I was scared to go into dentistry, because I was in Omaha at Creighton, and freshman year class, Warren Buffett came and talked to that in our Business 101 class. He was in with the dean, and he heartbroke me because he said, number one, when you pick a career, do not get one that's capital intensive, and don't ever go into a business where someone else sets their price. I'm like, oh, Jesus, Medicaid, Medicare, Delta Dental, they set all the prices, and it's capital intensive. So it was a really bad idea, and my dad tried to talk me out of it the whole time, because my dad had Sonic Drive-In franchises. He had like 9 of those, and Roger Carpenter had like 100, and Jim Williams had like 1,000. And then I told him I wanted to be a dentist, because our next door neighbor, Kenny Anderson, not only was he a dentist, he's still a dentist. And back then, no technology. I go into Kenny's, and he had this x-ray machine. It looked through the tooth. And then when he did the impression, he had his own lab, because back then, all the dentists had their own in-house lab. That went away. And my dad was saying, 8 years of college? He goes, after 8 years, you could already be a multi-millionaire with 4 restaurants. And I said, yeah, I get it, but I don't want to make cheeseburgers my whole life. And his parting shots was, well, okay, but if you're going to go to college for 8 years, you at least ought to be a real doctor. And he kept hounding that in me, so he made me apply to Creighton Med School and Creighton Dent School. And the proudest thing was showing my dad, okay, I'm accepted to med school, dumbass, but I'm going to dental school like my neighbor, Kenny Anderson. Who I thought was a real dentist. But here's the deal. Anybody, if your best idea is how to make something more expensive, you're not smart. I mean, I tell you, hold up your fingers. Is your idea better, faster, easier, cheaper, smaller? And you say, well, I need $145,000 of other people's money. Okay, it should have been killed at that. I mean, it should have been killed at that, but you needed a reason to keep going. And, I look at those lasers for $100,000. I still don't know what they do that I can't do with a $1 scalpel. You know what I mean? And, if you don't have to be smart to spend money. Where you have to be smart is to do something better, faster, easier, cheaper, and higher quality without spending money. And when I got out of school, average dental office overhead was about 50%, and now it's 65%, and it's going higher and higher and higher. So just go easy on the spending, man. Just really, really go easy. And what she said is, if you're just doing crown and bridge and implants, I think the market has spoken. It's 3-shape. But if you're going to do clear aligners, you got to go iTero, because Invisalign owns that space, and they did the incredibly aggressive. I mean, I can't even believe the FCC let it fly. I mean, I just think that should have been stopped.
Yeah. You can have a wonderful dental practice without having a scanner, for crown and bridge. I mean, you don't need that. You've got polyvinyl siloxane with a tremendous history and a tremendous accuracy. And the important thing, this is something that we've really learned. The important thing for either is to get the impression of the margins. And it is harder to get a good impression of the margins with a digital scan than it is with polyvinyl siloxane, because you can pack, it has to be clean, it has to be dry, and you've got to take it. And we examine all of our impressions. In fact, we don't even do it chairside. I mean, we can look at it chairside, but I let the final decision be made in the laboratory by the technicians looking at it under a microscope at 21x. That's way better than I'm going to be able to see. But honestly, if you don't get that impression right, like Howard, the technician can't get a good model. And if they don't have a good model, they're not going to have a closed margin when it comes back to you. And so you've basically built in your short longevity at the time you took your impression. So the problem with the digital scanning is that there's a shadow interproximally, particularly in a deep margin. So if you've got a supragingival margin, the digital is really great and it's very effective. If it's subgingival, you have to really do a lot of tricks to try and get it. And if it's really deep, you're going to be better off taking an impression. So that's my additional input for you.
Well, that was very, very good import. I want to go back to I slightly mentioned about when we talk about dentistry, what's really cool about dentistry is you go from Kansas to Kathmandu to a dentist that practices in a canoe, and they all use the same terminology. It's very, very scientific. And then when you go into political science, oh my God, every country has a different meaning for the left, the right, conservative, all that stuff. But again, the idea, the word first used for socialism was that individuals realized that they needed to own their own land. They needed to own their means of production. And you and I lived through where when we were little, every pharmacist owned the land and building, just like the dentist did, the ophthalmologist did, the dermatologist did. And now they're all going to work for, some big company. And what I don't like about that is my 4 boys, I'm so glad I never shot them all because they turned into 6 grandchildren, and the grandchildren, I mean, if you just looked at the 4 boys, yeah, I should have drowned them in the bathtub. But you look at the 6 grandkids, I'm so glad I didn't do that. And when my grandkids need a dentist, if they go to the dentist and it's owned by, Delta, or it's owned by Wall Street, well, where are my grandchildren going to go when they need a damn dentist? I don't want them going to a dentist where some office manager's calling every MOD a crown opportunity. One of them said the other day that 35% of new patients should have gum disease and need root plane curettage. And I said, well, I hope you go to a physician that thinks 40% of his new patients have chlamydia and just assumes that you do. Real doctors think that you should have chlamydia before you're diagnosed with chlamydia. But so the long rant is, we've seen this profession for 3 decades. When you look at these babies coming out of school, who don't even look old enough to drive, let alone be a dentist. Do you think that their chance to go into private practice is the same chance you and I had? Or do you think that it's going to consolidate and they're all going to be working at McDentals in 20 years?
I don't think it's going to consolidate and they're all going to be working in McDonald's,
McDentals.
McDentals. I think that things go through phases and cycles. And I think that right now, particularly with the extreme indebtedness that students have when they come out, that there is a tremendous tendency, towards going there. I think that the schools are kind of planting the seed that that's their only option, is to go into some sort of corporate dentistry. And even if they do, when we went to dental school, Howard, most of the guys, because it was all guys at that time, went into the service, and they had 2 years working for Uncle Sam in one of the branches, and that's how they got their speed up, and that's how they became more proficient dentists. So, going to corporate dentistry for a couple of years, whatever it is to build up their speed, get more learning under their belt. If you have a plan and you know that you want to ultimately be independent and you're set up personality-wise to be able to handle that, to want to be independent, want to be able to have the business controls, want to be able to control your own financial destiny, then if those are things that are important to you, then it's a matter of having a plan, working the plan, and ultimately getting there. And it's maybe not going to happen overnight, but you can have a long career in dentistry. So it's a matter of choosing what you want. And I certainly would feel terrible for our profession if it just went so that everything just became a employee type situation. I think one of the things personality wise about people that choose dentistry is that oftentimes they want to be their own boss. And if that's the case for the young students that you're dealing with and talking with, and the young dentists that have come out, I think they still have that opportunity in dentistry.
Well, what I want to do is, I have a, I just put on a bullshit monitor. You tell me that you don't want to do all this stuff and you want to pay down your debt and all this kind of stuff. You're just going to work for someone else. And I say, okay, well, you just graduated from AT still. It's 2020. Let's do an easy number 5. Let's go back to 2015. Let's get the names of all the graduates. And I'm sure they just went and got a job for a DSO and they all lived happily ever after. And that is clearly what we do not see. We see they've had a different job every year, and only when they're so broken and they're thinking, okay, I'm just going to jump off a building or I'll finally start my own practice. So they just have to get an all new rock bottom. And I don't get it. I'm one of those old grouchy farts that doesn't like anything new, because when we got out of school, we didn't have Skank of America doing the dental transition bank loans. The dentist carried the paper. So if I think you're a disaster and you're going to fail in Beverly Hills, you're just, you're trailer trash from Kansas, this will never work. But if you're approved by Bank of America, then hell, let's do it. And I've seen so many rotten deals. But when we were little, the dentist made his money 3 times. So let's say I had a practice and he's going to sell for $1. Well, he owned the land and building. That was another $1. And then he financed it. That was $1. So he'd say, okay, young dental student, you want to buy my practice? It's $1. And I'll be going to finance it to you for 10 years and at 10%. And that interest, he ends up selling it for $1, but the financing, he makes another $1. And then when the 10 years is loaned, the only variable in real estate is not having a tenant. Now you've been in this building for 10 years, you have all this brand, and then since you're an animal, you'll say, well, I have to own my own land. And then you'll buy the land and building because you can't shop it around, because you have to factor in how much it costs you to move. So those dentists would really screen the person because they're carrying the paper. They would make an additional purchase price by financing the paper. And then what was really cool is if you got in over your head or you got an upset patient and you said, hey, man, this Bill, he's threatening he's going to come down here and shoot me. He's like, I know, Bill. Well, I'll talk to Bill, or they'd come in, and it was just a much better system. And then when I got out of school, it was a very sexist time back then. The other side of it was, my gosh, old men would never help their boys. Like my sisters got their college paid for because they were a girl. And my dad, my God, he wouldn't go sign anything for boys. And that was very common back then. So what I do, I came down to Phoenix and I saw the center and I said, how much you want for it? And he said, $15. And he said, $15 square foot for 3 years. And I said, okay, I'll go $20 a square foot for 5. And Dave Cheatham said, okay, what am I doing with that extra money? I said, well, you built this 16-acre center. I'm a dentist. I don't know how to do it. You build out my 1,000, fine. Then we went down to Healthco, which was out of Dallas. I got rolled into Shine or whatever. And they just came in, and they loaded the whole thing up with equipment, and then they broke it over a 60-month lease to own. So I had a free build-out. I had free equipment. I just had to make the payment for 60 months. So you would get into a dental office with no money down if you wanted your own. And if you wanted to buy one, the owner would carry. And I just think those were much better. I do not think it's better than it's now. But here's what you got to do is you're always asking me about, should I own my own practice or should I be scared? Here's dentist problems. You're the only person in your town that knows right now the difference between a cosine and a tangent. You're too smart, and free enterprise, you need to be risk adverse. And there's no better way to be risk adverse than just being dumb and not knowing what you're getting into. So I always say when you get out of dental school, it's while you're that young, hell, you're 25. You could run into a window every day for a year and be fine. I made my 4 boys in 60 months. I'm most proud of that. She was 60 months, 4 kids. Opened up my practice. I graduated May 11, got open September 21st, made my 4 kids. And by the time I realized what 2 horrible ideas these were, hell, it was too late. I already had a practice. I had employees. I had kids. And then the next thing you know, you blink and that decade is just like a whirlwind. And then you're so glad you did it. You're so glad it's over. But what do young dentists do? They think about it for 5 years, and then they get used to a higher income, because what DSOs do, they're going to pay you just enough money to kill all your dreams and ambitions. And they want you to get your spouse a couple babies, stay-home mother, and a nice salary of like $150, and the wife saying, well, you're making $150. My dad lived in a trailer. Are you sure you want to take on all this risk? So they pay you just enough to keep your heart broken. So if you're coming out of school and you want to have 2 kids and start your own practice, just do it right now. Don't even think about it, because dentistry has about a 1% failure rate, whereas you start a new restaurant, 20 to 40% go bankrupt in the first year. Dentists, it's less than 1%. And dentists all go bankrupt for the same thing. They have their license taken away. Why do they have their license taken away? 80% of the time it's alcohol, 15% it's opioids, 5% it's cocaine. So if you can just not be a junkie or stay clean or get help or go to the Betty Ford Center. As long as you can piss in a cup, you're not going to go bankrupt. So, you're overanalyzing this. You know way too much. And I can tell you this. I've been in this long enough to know that you couldn't even get two prosthodontists to agree with anything you said today on the show. I mean, Dennis, it's like herding cats. And
I could get my two partners to agree with me. we've all seen this thing. You really exemplify something that's important for your viewers to see or hearers to see, depending upon whether they're watching or listening. And that is, you have a command of economics. You understand business, and you understand, the way that a deal is made. And I think that most people, when they come out of a health education, such as dental school, don't have any business background. So one of the most important things they can do, is to start to understand and get financial literacy. It was my husband who came to me. I was practicing with my dad, which I was still buying into the practice, which he never thought that I would ever get over buying into the practice with him. So I was making a pittance up there, even though I was outproducing everybody. I was Carl Reeder's associate, and he was controlling, my income there too. And Mark said to me, they are building the final building in the 4-building complex. And if you're ever going to have your own practice, this is the time you need to do it. And I remember thinking, I can't, I'm trapped. And this is kind of goes to what you were saying about them giving you just enough money where you can't, move because you can't give up what you are getting, but you aren't anywhere near what you feel your potential is. And so I remember thinking, I can't do that. And he looked at me and he said, you have no idea what you can do or what your borrowing capabilities are. And so I took the leap. He started his own business at the same time I started mine. That was not planned, but that's actually what happened. And neither one of us ever have regretted, what we did. And I wanted to just have a small practice. I had 5 operatories. It was just going to be me in the office. I had 5 employees I started with, and everybody said, oh, you're going to grow with this like your dad did. Because up there we had a 10 operatory practice with 25 employees. And I said, I will never do that. Well, here I am. We have 6,000 square feet. We have 25 employees. I've got 3.5 dentists. And, but this size, if you build it from a small beginning, and what you said about the economics on doing it, I sat my 5 people down that first day, and we didn't even have any furniture in my private office. And we just sat around the walls, and I had supplies set around there too, because we hadn't even set up inventory yet. And I said, well, here's the deal, guys. I have no money in the bank to pay you. So whatever we produce and collect this month, that's what we've got to work with to pay everybody. And they all just went, okay, let's go to work. And we never missed a payroll and never had pressure, on anybody to feel like we were just there for the money. It was just doing what you do the best you can and caring for your patients to make a good experience for them. And people like that, and they send in more people. And within a year, the practice doubled in size. So that's my personal experience. And, if you have the desire to have your own practice, every time is different. But I had to have my parents co-sign for me on the loan because they were still nervous about women. But at this point in time, we went in and we got a significant loan to go in and change all of our equipment, all of our cabinetry, and basically remodeled the whole office, which is now 8 operatories, the lab. And we finished all of that the 1st of March, and the 16th of March, we had to close for COVID. But we knew that we had to then get everything together right away. We couldn't sit around passively and wait until someone told us what to do. So we just dug in our heels, immediately started looking and seeing what we needed to do to move from a universal standard of care to a transmittable disease standard of care, set our plans, wrote an article, which they published in Dentistry today, and then had everyone back mid-May, and opened up business as usual in June. And we have been practicing as pretty much full speed ever since then. So whatever your challenges are, like I said, if you kind of know what you want to do and are willing to put in the hard work for it, and just set a plan, and like Howard is trying to educate you, have some sort of financial literacy about what you're doing, you can make good choices and end up where you want to be. So I wish you all good luck.
Yeah. Do you need to go, or can you stay on a little? I mean, I know we got over an hour, but do you need to get off?
No, I thought you might be tired of talking with me.
Oh, hell no. I still got some of my questions I got to ask. A couple of things I'm going. I always said, the best education you get is in your center. I don't understand why when people want to learn implants, their first idea is let's fly to the Dominican Republic. I mean, I never got an A in geometry or geography, but I'm pretty sure that's a different country. Why would you go to the airport, drive past 5 periodontist office to go fly to a foreign country? Because when you have an implant complication, you're going to want one of your best alcoholic drinking buddy periodontist to be able to bail you out. You're not going to be flying the patient back to Dominican Republic. So I think the best CE is your specialist in your backyard. And a lot of these dentists are asking these questions on Dental Town, and I'm going to ask you one because you're an expert in cracks, but they're always, young dentists are saying, well, I took out this MOD amalgam and there's a crack underneath it. And so the first thing, so they freak. So they're always going to take a picture. They're always going to post on Dental Town, and it's always like, would you restore it? Would you do a root canal? It's asymptomatic. So again, I look at that stuff, and I understand that you're a baby, but you really need to get that part down the best. And the best way you're going to do it is when you write up your best treatment plan is to walk it across the street to the periodontist and prosthodontist, and just hopefully they won't laugh so hard that they fall out of their chair. But what do you do when you take out an MOD amalgam and there's a crack there? Because you're always been talking about diagnosing cracks and all that stuff.
Yeah, well, what I do is I take a picture of it so we can document it, because you are now right in the sweet spot of what my research has been with Professor Jim Earthman for the last 30 years almost. It's like 25 years, something like that. But cracks are really important. It's the 3rd most common cause for the loss of teeth behind caries and periodontal disease. And this whole structural stability of teeth and implants is critically important. So what we've been working on is a diagnostic to make it easier for the dentist to know where there's structural problems and where they're going to find that. But let's use your example. They just took out an MOD alloy, and because of the alloy and the staining of that, you can see that there's a crack running from the mesial to the distal. If there's a crack that's that significant and it's a vertical crack, that's going down, which is what those mesial to distal cracks are, then you want to put a crown on the tooth. If you've got an oblique crack that's running under one of the cusps, then maybe you can do an onlay on that tooth, but you're going to need to do some sort of protective covering so that when the person bites down and clenches and bruxes, that they're not spreading the crack more, because just like in a crystal vase, every time it's hit, that sharp crack point just keeps propagating until you run into a catastrophic event. So that's one of the things that we're hoping that we can help dentistry with in the future with a product that will make it easier to diagnose cracks and fractures and structural instability.
Dentistry has, when my dad was in Sonic, the whole value chain was family. I mean, my dad ordered $1 million of meat from one guy a year. So when we went skiing in Breckenridge, his family did too. I mean, you all work together like an orchestra. And then I came out of dentistry, and oh my God, Delta will give them $100,000 a year for 20 years, and they only get one letter from you because you didn't cover something. You evil bastard, blah blah. I mean, I remember one time lecturing at a CDA and drinking at the bar with the Delta CEO and Delta California, and he said last year we did $1 billion of sales to these ungrateful bastards. And he says, not only have they never invited me to speak, but they got, look at the name of this title. And it was Bill Dickerson, and the name of his lecture was Delta or the Devil. He goes, can you believe these ungrateful bastards? All we do is go out there and sell stuff so that they get a subsidy, and we get just treated like crap. And so the they'll show me data, but they'll show me data like that if the endodontists do millions of root canals on a 6-year molar, just pick one to keep it standard number 3 and to get rid of all judgment. We're not like, well, is it failed? Is it short? Is there a PA? No, is it gone? Has it been extracted? When general dentists do a molar root canal in 5 years, 10% of them are no longer found on the radiograph. When endodontists do it, it's 5%. But the endodontists say it's probably a diagnosing error on a crack. I mean, they go right to the crack. They always think it probably got pulled because I didn't get an A on the diagnosis. But what I do with that stuff, I don't even care, because we warranty everything 5 years. Because when you get young kids out of school, some tooth will snap at the gum line. And whenever you're playing with other people's money, the entire government, no one even cares. So you're like, oh, well, I'll do a root canal, a post buildup, and I'll put on a crown, and I'll just be a hero. And then a year later, they come in, it's in their hand. And then they say, well, do I get my money back? And you're like, well, no, it's not my fault. What am I going to do? And it's like, no, you're going to warranty it 5 years, because if an average person lives to be 80, I mean, they're going to have to, if your dentistry only lasts 5 years and everybody's going to live to be 100, they can't afford to have all their fillings fixed 20 times. Do you like the way I could take 100 divided by 20 and arrive at 5? Yeah, I'm using a calculator over here. So the bottom line is just get your diagnosing and treatment plan skills. It's the most important thing you're ever going to do.
Absolutely.
I just can't say it enough. So Prosthodontist, they started, their website is, what do they do? It's Go to a Pro. And I got to tell you the funniest prosthodontic deal. I remember when I started my media company. I'm a dentist. I got an MBA, but I started the Ferrari Report in 1994, so I consider myself a dental journalist. I've had a monthly column ever since. And my sister, I mailed it to my 2 sisters in the nunnery. And my sister, Mary Kay, Sister Anne of Yahweh, she used to be Mary Kay, she read it, and it was about prosthodontists. And she called me up and she goes, what is a prosthodontist? And I say, why do you ask? And she goes, well, I know, Mary Magdalene's a prostitute. I know prosto is artificial and tut is love. So is it love of dentists? And I said, no, it's Odonto Greek, but it's artificial tooth. But I'll still always laugh about that the rest of my life. The first thing she saw when she saw prosthodontist was prostitute Mary Magdalene. That is just hilarious. But you say go to a pro. And, orthodontists are under assault because they were mad at general dentists when they started doing Invisalign, and now they're like, forget the dentist. I mean, now they're skipping the doctors and Smiles Club Direct. But what I want to go to is, do you think the Go to apro.org, the message, go to a pro, prosthodontist, because I see it with the Florida orange juice. They're trying to build their brand, drink Florida orange juice. Do you think the concept go to a pro, do you think it's working?
I think it is in some manner. I mean, I'm in one community, that's a little bit more, well, I don't know if I call Newport Beach urban, but it is when you compare it to many other cities throughout the country. So the people that we see have either been referred in by a dentist, or they've been referred in because they've got complexities. And so other people have told them to come see us. And then we also get patients who have absolutely no idea of our capabilities. They just heard that we were a good dental office, and so they come. So we kind of have this mix. But if you've got a problem, if you've really got a problem, I think that most patients are starting to be a little bit more sophisticated in their choice of who's going to help them with the problem, in particular if they've been treated and they've had failed treatment. That's oftentimes, we feel like we're the caboose on someone who's been treated numerous times, and then, they end up at our office, which creates some problems of its own because they're emotionally exhausted, financially exhausted, and they don't trust much anymore. So it's a kind of a unique group to care for. I'm glad the whole practice isn't that way, but we do have some of those. So anyway, go to a pro. Is it effective? I guess it is limited. They also now, what is the new motto is your smile are, what is it? Your smile are something or else. It kind of changed the approach a little bit. Your smile are commitment, or it's not that. It rhymes better. Anyway, so We'll have to ask them if it was effective or if they just changed it because they wanted to.
This is Dentistry Uncensored. We've gone over an hour. I can't believe, my gosh, Kyle, how much time are we on? How long have I?
An hour and a half.
Oh my God, I got Cherilyn Sheets for an hour and a half. I'm going to ask this question to last because if it's entirely inappropriate, we'll just cut it off right here. But I know you're a USC legend, and you are, and that school is amazing. And they've gotten some black eyes over at the USC Med School. The dean was having some wild and crazy parties, and then the USC, the whole scandal where parents were trying to bribe their way to get in schools there. Did you look at that as an adult and say, if you have 100 apples, one of them's rotten, or shit happens? Or was that a black eye on USC, and did it hurt you? Because I know you're a big USC fan.
Oh, well, I think anytime your university has problems, that they run into like that, the goal is to hope that the current administration and the people that are in charge can correct it. But the dental school has not had any direct connection, with those problems that have been on the main university and the main medical health science campus. So I think that they've been working really hard. Avishai Sadan is a great dean. He's been really trying to increase the significance of all of the programs, the teaching programs that are going on there, and they tend to be very innovative. So certainly they've got some great people that are there. They've got Pascal Monnier, who's just incredibly talented. There's just so many people that are luminaries that I think they feel wonderfully blessed to have on their faculty. So I wasn't too concerned about the dental school, but certainly when you hear that your school's name is blasted all over the place as doing some things that were inappropriate, that's not the best news of the night.
I was just sad that when the med school dean was caught with drugs and prostitutes, I was embarrassed it wasn't the dental school dean, because dentists are so boring that if we actually got caught with drugs and women, they're like, damn, I didn't know that my dentist could do that. It would have actually helped our brand. They wouldn't have thought we were
maybe the dean at Kansas City is going to have that happen to him. Then you can feel that way for real.
Oh my gosh. Was there any one? No, I don't want to ask that one. I was going to ask you about Son Endo, because there's another example where these dentists are doing a great job, and then someone comes along and says, well, let's just add $100 of variable cost stuff to it. I mean, again, my bias comes from this. Everybody remembers Henry Ford, but you don't remember why. There were 86 other car companies. The car was invented in Germany, but the model was always 5 or 6 guys build one really expensive car for a king or a queen. And Henry was the guy who came along and said, no, we're going to build a working man's car and who's going to make a $5 daily wage. And so if your best idea is to make something twice as much money, I grew up poor. And, we had 7 kids. My dad delivered bread at Rainbow Bread, but he saved his money and bought a Sonic franchise when I was 10, and that peeled my eyes out. I couldn't believe the lifestyle that it changed. But Son Endo, it's another $100,000 machine. It's a bunch of stuff cost. If your only idea is to do something better by spending a lot of money, then you're cut out for kings and queens. And I had, what was my last question that I wanted to ask? Last final question. Final question.
The final question. Sorry, go ahead.
The final is this. If you're in dental school, you might have missed this infinite wisdom on the difference between women and men. There's only, if women go up in something, men have to go down, and women always marry up. You could be the valedictorian of a dental school and marry the waitress from the Waffle House if she had just the right butt in a pair of Levi's. And every woman dentist you'll ever meet in the rest of your life, they're always married to bankers and lawyers and prosthodontists and this. And then every time I meet the dentist, his wife, it's like she couldn't get a job at the Waffle House. She'll never get a job. She spends $10,000 a month. So you get married at 25 to 65, and you marry the stay-home, destroy $10,000 of capital a month for 40 years versus I want you to look around your dental school class right now. I don't care what they look like. You're going to find one in that room and you're going to marry it because she's going to make $10,000 a month from age 25 to 65. So destroying $10,000 a month to making $10,000 a month is not only a $10 million difference, but here's something really neat. If you have a postgraduate degree, if both spouses have a postgraduate degree in the same thing, it's the lowest divorce rate in America. It's under 10%. When two dentists, two lawyers, two whatever get together, because you have something to talk about. You have something in common. So if you marry that girl in the class, you just got rid of 90% of the divorces. Instead of having someone that spends $10,000 a month, you have someone that makes $10,000 a month. But if you always wonder why women dentists are so damn happy, it's because they know their husband's at work right now. And if I look at you and you want to know why you're so stressed, your wife is so clueless that she's like this, my husband's really, really stressed, so I'm going to surprise him. I just bought first class plane tickets to Hawaii, and I rented a suite, and we're going to go there and get lime things on our eyes, and we're going to rejuvenate it. Yeah, when it's over, you're going to get your visa bill, and you just destroyed another $10,000, $20,000, $30,000. And if you say to that person, well, let's not go to Hawaii, let's just go camp to the lake, she's like, why do you think I married you? I mean, look how good looking I am. Look how you're not. It's because you're a dentist, a doctor, a lawyer, and this homie don't go camping. Most dentist wives, if you want to hide something from them, you put it in the oven, and their idea of camping is going to a hotel that doesn't put a chocolate mint on the pillow. So marry smart. Marry smart. I can't drive that message home enough. Marry smart. When you're in dental school, marry like a girl. Find someone who's smart, talented, ethics, hard work. Do not fall for that optical illusion that your eyes are playing on you.
So is that the same advice that you'd give the women students?
I just hardly ever see any example. I mean, I almost never, ever meet a woman dentist who married some nut job.
Okay,
I mean, even like a low job for a woman dentist would be like an accountant or an actuary.
Unfortunately, and I've probably been around more women dentists than you have. I have seen a number that have married people that definitely didn't share their same work ethic and actually saw the woman dentist as being the bread and butter for the family. And those marriages didn't survive either. So I think really maybe the crux to the message that you're trying to say is to choose carefully, make sure that you're not just letting your hormones, make those decisions, but that you're making sure that you have a common value structure, a common way that you can carry, your lifetime together as a partner, and that's something that is going to be critical. For myself, my mother-in-law thought that I was way above my husband's family. I was raised to have no concept of hierarchy amongst, different levels of society. My parents just raised me to think that everyone had value, and I'm just very grateful to them for that. But that wasn't the case with him. So she was concerned that I was going to dump my husband. But actually, he was my best friend. We met when we were 17. We went through college together. I saw him always being supportive of me. And I had guys in my class who wanted to marry me. And you know what their reason was, Howard? Because they thought that we had a 2-income family, and therefore, it was going to be a good business arrangement. But that wasn't what I was looking for. I wanted that soulmate, that partner that I knew I could go through life with, where I would be supportive of him and he would be supportive of me. So, I think that those are all good things, for everybody to think in terms of, because choosing your mate is probably the most important thing that most important decision you're going to make in your life. And you want to have someone that is going to be there for you, and you're going to be there for them.
I got out of school with $87,000 of student loans. My divorce was $3.8 million cash. So my student loans, or my divorce, was 43 times more expensive than dental school. So again, it's a huge decision, and right. Here's my decisions. Marry like a woman. Marry with your brain, not your gosh darn retina. Number two, own your means of production. And every time something goes south, the employees are all let off, but the owners are fine. And then if inflation ever takes off, owners can raise their prices, but not people who are rentiers of their time. So I'm going to let you go. There's fires. Thank you so much for coming on the show. Thank you for being my role model as I was getting my FAGD and MAGD. I saw everything you did. And if you ever want to... If you ever want to put an online CE course on Dental Town, we put up 400 one-hour courses, and they've been viewed over 1 million times. So if that's something you want to ever do with your Newport Coast Oral Facial Institute, Cherilyn Sheets, thank you so much for coming on the show.
Thank you, Howard. It's fun being with you.